Wellbeing Scrutiny Committee on the 21st of September 2021. It's not September, it's October. That's a good start. 21st of October 2021. Thank you, Democratic Services officers. Just to make you all aware that today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings, which have been previously circulated? Namely, your microphone should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand with Team? I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? The first item on the agenda is to do a roll call. I am Councillor Lynette Purcell, the Chair, and I am present. I will now call on Chloe, the Democratic Services Officer, to take the roll call.
Thank you, Chair. I've marked you as present. Councillor Charlotte Goldsworthy. Councillor Arthur Davis.
Present.
Councillor Oliver Davis.
Present, thank you, Chloe.
Councillor John Miller.
Present, Chloe.
Councillor Suzanne Paddison.
Present.
We've had apologies from Councillor Sonia Reynolds. Councillor Dave Whitelock.
Present, thank you, Chloe.
Councillor Aaron Wilcock.
Present, Chloe.
Councillor Carolyn Edwards.
Present, Chloe.
Councillor Wyndham Griffiths.
Present, Chloe.
Councillor Helen Clark.
Present.
And Councillor Nicola Davis.
Present, Chloe.
And then Cabinet members, Councillor Alan Lockyer.
Present, Zoe. Chloe.
And Councillor Peter Richards.
Present, Chloe.
And then we've got invited members, Councillor Del Morgan.
Present, all present.
And Councillor Simon Noyle.
I'm here, thanks, Chloe.
Then officers, Andrew Jarrett.
Yeah, present, Chloe.
Angela Thomas.
Present, Chloe.
Kerry Warren. Ethan Jones. Chris Frey Davis. Mike Potts.
Present.
Dave Hardin.
Present.
John Hodges.
Present, Chloe.
And Tammy Davis.
Present.
Have I missed any officers that are participating in today's meeting? Nope, I think that's the roll call done then, Chair. Thank you.
Thank you very much.
Sorry, I see Robert Davis had his hand up. I'll mark him as present now as well. Thank you, Chair.
Thank you very much. Can I just say one thing before we go on to the next item, which is the Chair's announcements? On my screen, I can see most people, even on the large gallery. I can't see Councillor Del Morgan. I can't see Councillor Simon Noyle. So if they want to indicate, can they please make sure that something is appearing in the chat or via Chloe to make sure that I give them an opportunity to speak. Oh, Del, you've appeared. That's excellent. Okay, thank you.
Can I just make a suggestion? If you click on at the top of your screen, participants, you'll get this come up on the right-hand side of the screen.
Yes, that's better. I knew that was
give you, whoever puts the hand up, it'll put it up in the order of the hand being raised. So that's a handy thing if you can use it.
I've got it now. I'm fine. Right, we now move on to the Chair's announcements. And agenda item 7, for anybody who wasn't in pre-briefing, that has been pulled from the agenda. So we're now going to be scrutinising from the Social Care, Health and Housing Cabinet Board items 9, 10 and 11, and also the impact of COVID-19 on disabled facilities grants on the scrutiny agenda. The second thing that I wished to mention in the Chair's announcements is today is the 55th anniversary of the disaster in Aberfan. And we thought it was appropriate to mark this with a minute's silence to remember both those who lost their lives at that time and also those who are still affected by the tragedy, even to the present day. So if we could just observe a minute's silence, please.
Could we
Thank you very much. Right, okay, so we're now on to the third item, which is the declarations of interest. Please can you indicate if you have a declaration of interest by raising your electronic hand, and Chloe will circulate a declaration of interest form virtually for you to complete. Can't see any indications. Can you see any, Chloe?
No, Chair, I see no indications.
Fine, thank you. So we're now ready to move to agenda item 4 on the scrutiny papers, which is the update on the impact of COVID-19 on the Disabled Facilities Grant. Are officers wishing to say anything before we begin, or are we going straight into questions?
Go straight to questions, Chair.
Thank you very much. Right, okay. Is everybody in the committee with us? Yeah, we're okay. We're on scrutiny item, agenda item 4. So first of all, I wanted to welcome on page 7 the fact that from the end of May 2021 and to September 2021, the number of jobs completed had greatly increased from 19 up to 73, which is really good news. And page 8, we really welcomed the positive feedback from clients who'd had a disabled facility grant carried out. We understand the lack of builders mentioned on page 7 and the materials which are hampering progress. But Councillor Whitelock wanted to come in at this point. Councillor Whitelock.
Yes, thank you, Chair. It's just basically going on from the report saying how much of an impact is the lack of materials having at the moment, if we know, and obviously this is going to get worse, and have we got a plan B in place if we are struggling that badly for materials? I know trying to source things locally at the moment is a nightmare, so trying to do it for a load of grants is, I don't know how you're going to cope really, but are we working on a plan B? That's my main question.
Would like to answer that.
Yeah, I can take that. Yeah, thank you for the comments. This is a national problem at the moment. We had a meeting yesterday with the South Wales grants officers meeting. All the authorities are pretty much in the same boat with it. I think that the biggest issue, more so than the shortage of materials, is the shortage of contractors, because they're all so busy, still carrying out all the works that were commissioned during COVID, when people were going on holidays. They were spending their monies on house renovations. So the contractors are getting materials. The cost of materials has escalated. Some timber prices have doubled over the last couple of months, which is the other thing we're addressing. We're giving them additional payments to obviously pay for the increase in cost. The majority of our works is the smaller works, the shower conversions. Those materials are fine. We're still sourcing them. Those are carrying on. The plumbers, there's less demand for their type of works as opposed to the general builders. So it's from the extension side of it where the delay is. It is moving, not as quickly as previous years, but they are moving. We are getting works done. There is work on site. There are builders working flat out for us. We have taken on other builders as well. which are carrying on with this work. So it is moving. That side of it isn't going as quickly as we like or we used to, but there's not a lot we can do about it at the moment. We're just pushing it through as quickly as we can. All the prep work is all done. All our side is all done. The planning, building regs, drawings, everything's in place. So it's just on a waiting list now with the contractors until they can fit us in. A lot of our contractors have booked us in for months and months and months ahead. So we've secured contractors. It's just working through all that work now until we can get it all done.
Dave, do you want to come back on that?
No, that's fine. I know it's going to be hard to actually predict what we can get in 6 months, 9 months, but I got a feeling it's going to be a nightmare for a couple of years with the supply chain. So
yeah,
one to keep an eye on, I think.
Exactly. We're working closely with Swansea at the moment to try and produce a regional bill of quantities. So looking at the cost of it. We met them last week and we've all agreed that there's absolutely no point in us doing it at the moment because the costs have escalated. We anticipate the cost to decrease again in a couple of months, but then, like you say, they could go up again next spring. So they're up and down at the moment. So until things settle, we're not going to set the bill. We'll just address the various increases as and when we need to, and then decrease them when we need to as well.
That's great. Thank you.
Thank you for that.
Okay.
I wanted to just mention something about occupational therapists. It makes several mentions on several places about the occupational therapists.
Yeah.
And I remember some time ago that there was a shortage of occupational therapists and that this was holding things up. I just wondered, could you let me know whether the occupational therapist service is working to full capacity or are there still hold-ups?
Yeah, you're right. There's been a huge shortage. Sorry, Angela, did you want to step in?
No, go ahead, Rob. I can complete it afterwards.
Thank you.
Yeah, there has been a shortage of OTs, and there still is. Our OT service were at the full capacity staff-wise for a short time, but now they've lost some members again. They are working as best they can, but with regard to us, the waiting list is either at OTs or at us. So if the OTs are at maximum capacity, they do all their works, they come to us, then the waiting list sits at us. Or if they can't see to all the clients immediately, then their waiting list waits there. So as a whole service, there's always that slight delay, either it's their end or our end. So at the moment, with the slight delays we have, it's all working fine. I think I mentioned in the report we've got about 15 in the waiting list at the moment. So we're still getting 10, 15 a week in through from the OTs, and then we are dealing with that 10, 15 a week as well at the same time. So the through flow is working well with us on the OTs.
I think those were the words we wanted to hear, that the flow through is working well. That's the key thing.
Yeah.
Right, thank you for that. Councillor Kerry Clark, you wanted to ask a question about means testing.
Yeah, following the Welsh Government's announcement on the 10th of March this year about not means testing for small and medium-sized adaptations, can you confirm that you're no longer doing that? And if not, why not?
This has come up a couple of times. I have responded to various people, and in fact, I'm in the middle of doing a report on it now, which will be coming to scrutiny at some point when we get more information. Now, it's not as straightforward as just removing the means test for the small and medium grants, because what we anticipate the demand to increase massively. We anticipate the increase could be several £100,000. So what we want to do, we had a meeting with the Welsh regional boys about it yesterday, is that if we remove the means test, in its place we'll be putting conditions to try and control the demand. So these conditions could be a financial limit, they could be a limit on the amount of grants they can have in the year, and it could also be repayment conditions. They could be for the whole lifetime of the grant, and it could be for the full amount. So there's a lot we need to take into account. Otherwise, it's going to put such a massive strain on our budget. Within a couple of years, we're going to have huge waiting lists. Some figures we've looked at, we could be looking at £700,000 to £800,000 worth of additional demand a year. So we need to control this without discriminating against the people that genuinely cannot afford the works, which is the case now, the ones on passport and benefits. So what we don't want, we're already getting queries from people saying, well, I don't want to declare my financial information. I'll wait until you drop the means test, then we'll come into you. So we're getting a lot of these queries. So you can imagine the demand then that's going to come into us is going to go massive. And all authorities are very, very worried about this. So we need to put a mechanism in place that we can control it. So I spoke to the Welsh Government yesterday about having two different ways. One, the existing route which we go on now, which is a means tested route, which comes with the conditions that are in place now, or a secondary route where if they don't want to be means tested, that's fine. It's up to them to make that decision. But then they can go down the non-means tested route, but then it comes with the additional conditions, which it's wrong to say is putting them off, but it's to make sure that this money goes in the right direction. We'll also look to ring fence a certain amount of our budget to make sure that this doesn't then take over the whole of the budget. So then if we allocate, say, £250,000 to non-means tested grants, once that's spent, it's spent. We then start having a waiting list. So we need to bottom this out. Again, we're working with Swansea and Bridgend on it to try and get a regional approach, but it really isn't as simple as just removing the means tests and carrying on, because the impact of that is going to be massive.
Helen, do you want to come back on that?
Yeah, can I ask that when you have sort of formulated your plan or whatever, that it comes back to us for scrutiny, because I think it's important that we have some input on this as well.
Absolutely, my intention is to bring the paper for your input and guidance before we implement anything, before we make any decisions. So obviously it's a big decision to make. We need to make policy changes off the back of that, which is going to be a huge amount of work. So that's the paper I'm working on now, is to bring to scrutiny for your opinions, for your thoughts, for you guys to discuss it, and then to come back to us to give us direction in which way you want us to go. And it's not, it's a discretionary measure as well. So, the bottom line is we don't have to do it. It's not mandatory, but Welsh Government are trying to push us because they're not making a legislative change. So it is something we can opt out of if we want to.
Right. I think, again, as a committee, we're reassured that you are working on a paper. You're going to bring it back to us and we're going to scrutinise it. Yeah. Councillor Paddison, I can see your hand indicating, I know you wanted to speak at the end of this debate. Is this another issue, or is it what you wanted to say?
No, it's pertinent. We are going to be later on in the meeting. Obviously, I did make a suggestion that something would go on the forward work programme. So I think this is very timely that a report is in the process of being prepared. So when we do actually put it on our forward work programme, we're going to be expecting that. So I think, the timing is just about perfect, Chair. Thanks.
So we're literally killing two birds with one stone there, because we had various questions in pre-briefing about disabled facilities grants, but what we decided was to put it all onto the forward work programme, and then we can ask all the questions that we want, including the ones raised in pre-briefing by Councillor Wyndham Griffiths. Excellent, so that ticks that box. Brilliant. Suzanne, you wanted to say something nice at the end of this.
Yes, I did, Chair. Yes, thank you very much. What I wanted to say was that I know that within the council there is a will to get these grants done as quickly as possible, and I really wanted to compliment the department, Andrew and his team, and Peter for getting a stair lift in the real height of a pandemic. For one of my residents, and it's been appreciated ever since. They've commented so many times how pleasing it was that even though there was a pandemic raging, we managed to get that done. So I wanted to give thanks to the teams for that. Thank you.
Thank you.
And on that positive note, I notice that there is no recommendation. This is just for noting. Are we quite happy to move now to the Cabinet papers? Anybody? Right, okay, I'll give you 2 seconds, including myself, to change papers, and we shall carry on with agenda item 9 on the Cabinet papers. Just give us all 2 seconds. Right, agenda item 9. Right, okay. Just wait till you all look up, and then I know you're all on track. Do you know, this doesn't half remind me of when I was teaching. Right. If you're all looking up and smiling and nodding, then I know you're all ready to carry on. Excellent. Not quite. Angela's still catching up. Everybody else happy? Right, good, excellent. We can carry on. Okay, agenda item 9. There are a lot of things I wanted to mention here which are positive, and so much of our discussions are about things that are really difficult and controversial. I think it's important we do start off with these positive points. So from the top, to congratulate Kerry on the reports that the children's from April 21 to June 21, all the reports are green despite the pandemic. Well done. I know from the private meetings that we were having the imaginative ways that she was carrying on delivering her service. So well done for that. Congratulations on the homeless statistics, on the adults' performance measurements. Pleased to see on page 63 that there are now a low number of agency staff, which certainly wasn't the case in the past. Pleased to see the continued decrease in looked after children. Particularly delighted to see on high level measure 11, page 77, that Neath Talbot is now leading the way in outcome focused practice. And as we know, this has been, how can I put it? It's been just a total different way of looking at things. It's been a cultural change to say, not this is what we're doing, but what is the actual outcome and what are people telling us about the outcome? So I'm absolutely delighted, and the whole committee are delighted to see that. We were very grateful for the case studies. We particularly loved Mary the chef's story, that once they realised she wasn't eating because the food was not to her taste and suggested that she actually went into the kitchen and tried to make the food better, that everybody had a win-win situation. That was a lovely, lovely case story. And particularly in my role as having been a former teacher, delighted to see high level measure 12, page 85, the children writing their own comic book, challenging and changing the terminology. We've decided as a committee we will never again refer to LACs. They are looked after children because that's what the children want to be called. And also delighted that the book is to be distributed throughout Wales. So those are the positives. Now we have the questions. Councillor Edwards, you wanted to ask a question referring to page 61.
Yes, please. I just wanted to ask, there's Q1 performance monitoring in adult services. Why are the vacancies among social workers so high? And the same about the long-term sickness levels. There is a part explanation on the following page, but I just wondered if could have some information on that. Thank you.
Yes, Chair, I can answer that. So in terms of the report in front of you, it's very misleading. So if I explain to you in terms of the vacancy situation, this isn't social work vacancies. This is vacancies across the whole of adult social care. So 20 of those vacancies will have been vacancies for 4 years in the in-house home care service. So originally, we wouldn't have filled those posts because we were retaining them to help support the budget issue. For the last 2 years, there's been an external recruitment campaign for those posts, but unfortunately, we're not able to fill them. So that this is the issue we've got nationally with not being able to recruit people into domiciliary care. So you take 20 of those posts out, that leaves us with the remainder. 20 and a further 20 of those posts are new posts. They've been established on a temporary basis out of different funding streams over the past 2 years. So they're not vacancies, they're just posts that haven't been established permanently into the base budget. So the only vacancies we've had in that quarter are 4.8 people, full-time equivalents. So this picture that you're showing here is very misleading, and I'm working with HR officers to change how this is presented, because we haven't got a problem in adult services with vacancies. So that's...
Yeah, thank you for that. I'm glad you're going to try and work on some different way of presenting it, because as a committee we can only look at what is in front of us. So
it's very misleading. When I went through it, it's great that you asked these questions, because when you look at it, it makes absolute sense to ask it. But if you looked at, I'll come on to the sickness levels again. It's presenting as looking like it's high, 39.5 full-time equivalents. But if you look at the breakdown, 21.5, almost half of those people are in our in-house domiciliary care service. So if you think this is the team that's been going out between 7 and 11, all the way through the pandemic, it was, at some point you knew this team was going to get exhausted. Now, if you look at that whole figure as a percentage of the whole of the adult services workforce, we're in the best position we've been for many, many years in terms of sickness. So that is just, as we stand, I think we're in single figures as far as sickness rates go. So we haven't got, I just have to reassure committee, we haven't got a problem with sickness, we haven't got a problem with vacancies. But I take the point, that's the way it's presented, and I've spoken to HR officers yesterday. I'm going to do it and break it down under principal officer remits, so it's very clear whether it's social work, whether it's direct services, whether it's day services, etc. And that will give a more meaningful overview of what it looks like in adult social care.
Thank you very much for that. I can't remember the quote about lies, damn lies and statistics, but it's something like that. Statistics are great, but not always great. They don't always give you the full picture. Thank you for that. Helen, you wanted to ask a question about occupational therapists.
Yeah, thanks. Is what you've just explained about social workers, is it the same with the OTs, or do you actually have vacancies for 7 OTs?
We do have vacancies in OTs. It's an ongoing problem, and it's a problem nationally. So, for example, when the OTs qualify from university, we all go out to grab the same group of people, and the 6 that came out into our region all opted to work in health. That's what happened. Yeah,
that was going to be my question, actually. Are we competing with health for OTs? And is what we're paying and all that kind of thing comparable to health?
It is comparable. If I give a further explanation on that, then so there's 2 bits to this. We've had an ongoing issue about recruiting into the in-house domiciliary care workforce. Right? People have opted to go and work for the NHS. The feedback we've had from people who've left our external providers is everybody claps for the NHS, nobody claps for us. That's the sort of feedback. So there's more kudos being attached to. So what we've done recently is gone out with a joint advert on the NHS website. So input from both social care and NHS, and we've attracted 50 applicants across the region. So this is all good news. We're doing exactly the same with the OTs, is we're putting in, as we do for the social work degree training, where we fund people in-house to become our future social workers. We're doing exactly the same with the OT service. So where we got OT assistants, we'll grow our own. That's basically where we're coming from with this. So there's a couple of strands across workforce, and I think we've acknowledged across the region, we're all competing in the same pool. And that's been the problem. But there are plans in place. Like I said, very positive feedback in what we've just received, and those interviews are going ahead next week for the 50 plus people. So I'm hoping I'm going to have a good news which will allow flow through the system in terms of getting people out of hospital, etc.
Thank you. I'm very glad you asked that question, Helen, because that's very positive news. It's forward thinking, isn't it? It's thinking outside the box. If we're all competing for the same people, let's advertise together. That's fantastic. Suzanne, do you want to follow on from that?
It was just a quick supplementary. How long does it take to train an occupational therapist?
Oh, thanks for that question. Well, I believe they go on the 3-year degree course, the same as social workers. Yeah.
Okay, thank you.
Right, yeah. So as there obviously is a considerable demand for them, many of them us have got young people in our family looking at possible careers, be an HGV driver or an occupational therapist. Fine, that might sort out the builder's supplies that you were worrying about, Dave. You never know. Right, okay, let's keep going. Yes, I'm on page 96 and I'm looking at the Quality Assurance and Learning Framework. I just wondered, obviously it's extremely well written, but who is it issued to and used by? The reason why I ask is on page 98, where it's talking about the customer services standard. It's using language that assumes that this is going out to a service user. And I just wondered, could you clarify on that?
Yeah, thank you, Chair. I'm happy to pick up that question. So the document is a document that's designed for internal use.
Yeah.
The customer service standards were, when we developed the framework, we developed it internally with practitioners, managers, senior managers, but we also reached out to the wider community, parents, children, and other groups, carers, care homes, to find out what was important to them. So in the spirit of that outcomes focused approach to practice, this framework is also essentially outcomes focused, in that what we are seeking to achieve is what difference are we making. And those customer standards are essentially what our service users expect of us. So when we go about our quality assurance work, at the heart of all our work are those questions that we ask of ourselves when we are undertaking dip samples, audits, etc.
Great, thank you very much for that explanation. We had no other questions indicated during pre-briefing. Is there anybody else who wants to ask anything before we conclude this item? Oh, Councillor Edwards.
Yeah, on page 102 and 103 regarding the audit, there's a huge piece of work there, very detailed. And I just wondered, with all the sort of work that's going on, the intense work that's going on at the moment, are managers able to cope with all these meetings and assessments and so on? Thank you.
I'm happy to pick that point up as well, Chair. Yeah, it's an important question, certainly at this point in time where we are experiencing difficulties. As a quality assurance group, we meet fortnightly. We have representatives from across children and adult services, and the audit programme is essentially, we have a forward work plan, and the list you see there is just some examples of the meetings we will observe over time. The expectation is we wouldn't observe all of the meetings at one point in time. So we are very much aware of the pressures across the service. So we have taken a foot off the pedal a little bit insofar as in recognising the pressures across various aspects, parts of the service. So yeah, the managers aren't past the framework and expected to audit all of these things at one point in time.
Thank you very much for that question, Councillor Edwards, and I'm sure the officers appreciate your sympathy. Excellent. So there's no recommendation, it's just for noting. Are we happy to conclude agenda item 9? Everybody? Great. We're now on to agenda item 10. Give you 2 seconds to find the appropriate paper. Okay, right, here we go. Again, try to say something positive before we begin. We very much welcome the initiative, and particularly Valleys members are pleased to see the recognition that the Valleys are disproportionately affected by this problem. We sympathise across the board with the officers, the providers and the families that we find ourselves in this situation. It really is an incredibly wide-ranging problem. The figures are extremely worrying. I think as a committee, we would be minded to agree with this uplift, but we have a lot of questions first. And I'm particularly grateful to Councillor Kerry Clark, who's going to come in here now, as she works in the field with her view from the other side, working with people and giving us particularly case studies. So Councillor Kerry Clark, take it away.
Thanks, Annette. Yeah, as you know, I work with people in the community, supporting them to access things, and I'm working with a number of people in Neath Talbot at the moment who've received notice from their care provider that they'll no longer be receiving care. And although the social worker has been absolutely brilliant, there is nothing there, as you know, for her to access to get my clients what they would like without splitting them up and putting one in a care home, which is not an ideal situation either. So I would really love to know, and I know that the social workers are doing their very, very best with this, but what are we doing to ensure that these people who've had their packages removed are safe, well cared for, and are managing to live independently? And you know, what can we do to put something in place for these people, because they're very much being, you know, left on their own otherwise. And my other question would be, you know, how do you know that this uplift is going to work in attracting staff? And is it going to actually be enough? Because in my view, it doesn't even seem to be enough. I don't think it is even going to touch the sides, but I'm sure you'll be able to put me straight on that. Thanks.
Right, that's a big question, and I can see Angela indicating, and Andrew. Who wants to go first, Angela or Andrew?
I'm happy to defer to Angela.
Right, Angela.
Right, to answer the first question then, in terms of what are we doing, we have found ourselves this last week in the most difficult position we've ever been in Neath Talbot. So for the first time ever, we have been in a position where we have to offer people a place in a care home as opposed to staying in their own home with a package of care. That is the first time in the history of being in Neath Talbot that we found ourselves in that position. So I'll be honest with the committee, we've got 41 people sitting in the community at the moment who are being supported by family and friends, who have been assessed as requiring a package of care. What we do to mitigate that is that the social worker visits every month. We make telephone calls every week. We make welfare checks. We're using our local area coordinators to look into these families just to make sure they're coping. But we have had since September 50 handbacks from external providers where staff are walking away, and we've got a further 8 coming back to us in the next 2 weeks. So we've never been in this dire position. We've always managed to pull it out of the bag and sort of change, you know, runs around between us and the external market to make this work. But this is the first time we found ourselves in this position. So to ask the question what we're doing everything we possibly can, and it's an absolute last resort to have to offer somebody a place as an extended care in a care home. That's not what we want to do. We're actively out for recruitment. The good news is we're interviewing 10 people that have come forward from the external recruitment this week. That's not including the people I spoke to about on the regional basis that came through on the NHS website. And in terms of the 10%, it's a risk. It's an absolute risk. We can't tell you that it's going to absolutely work. But Shelley is with us on the call, has spoken to every single provider. We put a number of options to them. One would be a bonus payment, for example, to incentivise people to come and work for us, or to sort of thank people for staying with us through the months. That affects people's benefits. You'll be fully aware of that, Councillor Clark. And what it had an adverse effect first time around is that people took the money and actually went off sick. So that wasn't helpful first. And, you know, I'm not speaking untoward. People are tired. This workforce is very, very tired. All of the providers said they wanted some form of continuity, and they were happy to accept 10% on the hourly rate. Is it enough? Who knows? I don't think you can put a price on care at the moment in the way things are in the community, but that's what they've asked for. That's what they're happy, and we've written it into the contract that that money is passed on to the front line, to the actual workers. So we will be monitoring that via our contracting team. So, you know, I'll let the director speak now, but we're doing everything we can to try and sort this situation out. And it's a national problem. It really is.
Andrew?
Yes, thanks very much, Chair, and thank you for that question. I think the question you've asked is the question that I've been asking as well, Councillor Clark, which is, are we leaving people in the community without any care? And I've been assured that isn't the case. So where people absolutely need care, we are prioritising that and making sure that's happening. Where we can't provide that care and family can't then provide that care, as Angela says, we're having to make the really difficult decision to offer them a move to residential, which is not a place any of us wanted to be. The situation overall is far from ideal, and I have briefed this committee on a number of occasions about how difficult things have become as we've been dealing with COVID-19, and we still are. And clearly that's had an impact on what's happening across a wide range of aspects in adults and children's services. And there are huge risks to this. But I think that the risks, and I'll outline some of the risks, but the risk of not doing anything is that the situation gets worse. And so whilst we might not have solved the situation by offering a 10% uplift, when you look at the affordability of it all, that's probably where the best place that we can be at the moment. And we felt that we have to do something to even if we are able to retain the staff that we've got at the moment in the external market, that will be a bonus for us, because at the moment they are leaving in numbers which are affecting our ability to provide that care. Some of the risks, of course, are substantial. So one of the risks is that this is for our external domiciliary care market. We're not suggesting an uplift for our internal market. So that's a risk in itself, our internal workers. And also this doesn't cover residential care workers. And again, that's another risk, that actually that people might migrate from residential over to domiciliary care. Now, we've done our research. We don't think that's the case, but there may be some that do that. But to offer 10% across the whole of the sector is just not affordable for us at the moment. And so what we're saying is the Welsh Government is, actually, Welsh Government, we need some of these funds. We need some sustainable funding, which allows us to uplift to the real living wage for all of our care sector staff, and start to recognise the huge benefits that caring staff make to those people who are most vulnerable across Wales. So we're saying that to Welsh Government. And then the final thing I wanted to say is there's a further risk in this, which is whilst it is affordable for us for the rest of this year and for next year, the ongoing funding is far from clear. And again, without additional monies from Welsh Government to support this, it will be a pressure on our budget, which we will have to find from within the social care budget. So that will be really difficult. You know, we're talking about, you know, over £1 million. We've already got lots of pressures, and we do know that we will have to support residential care at some point as we go through this year. So none of this is easy, Scrutiny Committee. It's really difficult, and we're trying to take the steps which, you know, our expertise tells us are the right steps, our research tells us the right steps, but we do want to take a step. We could just be mulling this over for the next 9 months and not taking a step. And I'm saying, no, absolutely, we need to do something. We need to do something now.
Thank you for that. Suzanne, I can see you indicating, but I just want to come back to Councillor Carolyn, because the question that you were going to ask, that we were both going to ask about, how can we guarantee that the money is going to be used to increase rates of pay? I think Angela has just told us that that's written into the contract. Am I right?
Yes.
So I can cross that one out. I also had a question about what are we going to do going forward? This solution is for now, and Andrew's just answered that, which is basically, we don't know, but we hope that we're going to have some funding from Welsh Government. Suzanne, let's have your question.
Yeah, it's just occurred to me now, as the debate has come round, is I have the utmost confidence, Andrew and Angela, in what you're trying to achieve here, and if it doesn't work, it won't be for the lack of trying, and that is appreciated. Are we suffering from the lack of EU nationals at all? Or is it just that people in the care sector are knowing their worth now and voting with their feet? So is there any part of it which is a lack of EU nationals?
I've got data on that if you want me to come in. I don't know.
Yes,
because we did that research prior to leaving, you know, prior to Brexit. We did work with the sector to understand the impact of Brexit on them, and no, actually there was very low numbers of EU nationals working in the care sector in Neath, Talbot anyway, and those that had applied for the rights to remain thing. So they've done that. We did that work with them. So it isn't that. I think, you know, I think all of us can appreciate how challenging last year was, and it's not just last year in care. We are continuing to have those challenges, and I think there's a lot of reasons. There are competition within that level of workforce where, you know, we all know certain companies and organisations in completely different sectors other than care are offering very strong rates of pay, and other sectors have got more employment opportunities, so there's more jobs out there. And I think really, you know, a lot of care workers are exhausted. And, you know, it's been a very challenging time for the care workforce since, you know, the COVID pandemic.
Okay, thank you. That's a very comprehensive answer. Thank you.
Yes, thank you for that. My next question, Andrew, I think you answered as well, which was in the risk section, it said risk that not implementing the same levels of uplift in care home sector could result in care home staff leaving their employment. My question, what controls, if any, do we have to prevent this potential crisis? Basically, we haven't got any. No? Am I right?
Well, I wouldn't say we haven't got any. We're not at this stage saying that we're going to replicate this across the residential care sector. But you know, we have done our research, as I said, and we have taken a view that actually where we've got most need at the moment is in the domiciliary care provision. There is a whole redistribution exercise, I think, that's going to happen across our residential care market over the next 9 months or so, as Welsh Government funding, support funding comes to a conclusion. There will be care homes that probably don't make it through that period of time and go to the wall. So I think there's going to be a redistribution of staffing across the piece, and we've got to be mindful of that when we're weighing up the risks and what we're going to do about residential care. But there will need to be finances at some point over the next, as I say, 6 to 9 months to support those residential care homes that will need support, because we can only have a market that's got, you know, I don't know whether we can put up with a 20% reduction in number of care home beds across Neath Talbot, whether that's 30%. I wouldn't want to go much lower than that when we can see that there is a continued need for residential care, and I'll come on to that when we talk about the next item, Chair. But yeah, there are risks, and I think the mitigation is that we have really good managers within the service who know the market. So this is a calculated risk.
Thank you very much for that. I can see, Angela, you're still indicating. Do you want to come back, or is it a legacy hand?
No, the question was asked, what are we doing about this? What are we trying to do? And I think just to give some reassurances, despite what we're trying to do with the external market, as a council, we're taking a council-wide approach to this. So we've got a group of officers together looking at targeting the universities, the colleges. We're looking to, you'll be aware, first time round when we went to a call of arms for our own staff to go into residential care and domiciliary care, we're doing that on a council-wide basis and seeing if we can have a bank of staff that, if it comes to this position, can we at all costs avoid somebody going into a residential care placement. So, you know, don't do it. To be fair to the wider council, this is a wider council approach to adult social care. We're not left on a limb. So, yeah, there are things in motion.
Thank you very much for that. Yes, I remember the call to arms and the incredible results that you got from that. The spirit is there. It is like a spirit, not that I was around at the time, but it does seem to be a spirit rather like in the Second World War, where we were all up against it, our backs were against the wall, we all pulled together, thank goodness, certainly in the communities. Right, okay, I had no more indications during pre-briefing. We have a recommendation on page 120. Are we happy for that recommendation to go to the Cabinet in its present form? Yes? Nod, yeah. Anybody to second that? Anybody? Oh, thank you, Helen. Thanks. Great, excellent. So that is agenda item 10. And now we go back to our papers and we look at agenda item 11. Okay. We tried to second guess how this debate was going to run in pre-briefing, and officers obviously are not there in pre-briefing, but we do usually have quite a controlled pre-briefing where we have a pretty clear idea of who's asking what, when, and in what order. No, not with this one, right? We have tried. The most significant thing I think about this is that we may need to go into private at some point if there are issues raised where the officers who will communicate with the Democratic Services Officer and myself that, no, we're straying into the private part of the report, then we will have to stop and go into private. We'd like to try and leave that to the end of the debate, but who knows, right? I know I'm supposed to be chairing this. I haven't got a vice chair. We'll just make it up as we go along. Right, okay, first of all, I always like to try and start with something positive. So I want to welcome the very detailed and balanced report. And I want to thank officers for giving all sides of the argument for and against. When I was reading it, before I got to the recommendations, literally, we were just going backwards and forwards. This is good, this is not good. We have a member of the press waiting to be admitted. Is he in?
Yes, Chair, confirm he's in now.
So, again, to thank the officers for giving such a balanced report where we can see the implications of any decision, both for the people of Glyn and for the wider population of Neath Talbot who would require social care. It's a very, very difficult balancing act, and we appreciate the fact that the report was so balanced and gave all sides of the argument. Right, questions. The first question is just factual, and if officers you feel that this can't be answered now, we'll postpone this question to the end of the meeting and we'll go into private. But I wanted to ask on page 133, it's talking about the two funding arrangements, page 133. If we recommend funding agreement A, where it says Pobble maintain the repairs and maintenance liabilities, is it your understanding that Pobble would be in agreement with that? So we assume that this has been discussed with Pobble, but we'd like assurance about that. And also on page 145, it says, in the event of us choosing to support option 2 or 3, Pobble would require the council to pay full cost recovery. Now, not being economists, we'd really like clarification on both of those. But first of all, can you think, is it your opinion that you think this can be discussed publicly now, or does it need to be done in private? Anybody? Angela, Andrew, anybody? Andrew?
I think it's in the report, Chair, so I think we can discuss that. And I think if we stray into other things, I'm happy to jump in at that stage.
Brilliant. So first question, are Pobble likely to agree if we recommended funding agreement A?
I can quickly answer that. Yes, they will agree. This has been a long negotiation with the Pobble group, and we've made them aware of this report, and they are in agreement with it.
Thank you. So the second question, on page 145, in the event of option 2 or 3, Pobble would require the council to pay full cost recovery. Can you give us any clarification on what that implies?
I can, if it's okay, I can, just because I, wrote that, and it's probably me not being clear. So what that means is that that's the explanation for why the prices put forward are different to the previous prices, if that helps. It's the explanation of why the rates for contracting this service going forward are different to the previous rates that were paid, and the details behind that will be in one of the confidential appendixes.
Right, okay, so we might go into detail when we go into private for that bit. Right, okay, Andrew, your hand's still raised. Did you want to come back, or is it legacy?
I couldn't see my hand raised, but I'm happy to just to say full cost recovery to me when we were discussing this with Pobble. So what we've agreed is that if we were going to make an extension to the contract, that we would have to have a totally separate contract and to take all of the costs of running Trem Glyn into consideration. So that's the full cost exercise that we talk about, rather than it being maintained as a part of the overarching contract where we pay for all of the Pobble beds across the Pobble estate that we have in Neath Talbot. So that's the difference. So it would be a standalone contract with Pobble to run that, and what they would charge us is the full rate of the 27 beds.
Right. Now it's that last sentence now makes sense to me. Yeah, right. Thank you very much. Committee, did you follow that? Can I see a few nodding heads? Yeah, brilliant. Thanks for that, Andrew. It wasn't absolutely clear, but I think we're okay now. Right, we're going to go into Councillor Carolyn Edwards now, who is a member of the committee, and although she's not a ward member, the ward that she represents is neighbouring to this particular ward, and all her residents are inclined to naturally go to Trem Glyn from choice. So she'd like to present now. Take it away, Councillor Edwards.
Thank you, Chair. Yes, thank you very much for the detailed report. And if you bear with me, I've written some notes, and I think throughout the debate now, we've had some of the answers. My mind is going around in rings with the finances and so on, but if bear with me, there are some questions in here as well. First of all, I'd like to say that the report has identified all the concerns felt by many with regard to the closure of Trem Glyn. Not all of us were here in 2016, officers or members. I wasn't at the time, although I was heavily involved with the campaign to save Trem Glyn at the time. I would like to say that I think that the whole process has been flawed from the consultation in 2016 through to this present report. The consultation on the proposed closure of Trem Glyn was held between August and September in 2016. And, you know, cynical me say it's always a good time to hold a consultation when people are going away on holidays. And I do feel here that the concerns of the constituents were totally ignored. As we've already said, Neath Talbot were to build 4 new homes in Neath Talbot, and they've reneged on that, and they chose instead to close our welfare in the Avon Valley and Trem Glyn in Gleneath. And that is repeated right throughout the report. The decision was made in 2016. We know now that just 2 new homes have been built, one in Neath and one in Port Talbot. Throughout in the report again, it says Pobl were contracted to operate Trem Glyn until 2025. This has now changed. The major renovations that we've just discussed have been carried out on this site with these dates in mind. So I'd like to know, why has this decision now been changed? Pobl, again in the report, were to deliver a service exit strategy by September 21. Where is this exit strategy? We haven't seen that yet, as far as I'm aware. And if officers know of this strategy or have seen this strategy, have any decisions been made on it prior to this meeting? So I'd just like to say, if there's no exit strategy and no sight of the new proposal for care services in Gleneath, which Pobl promised us, the proposals today are premature, because how can we make an informed decision on these options when we don't know the full facts? On page 136, the para 3.1.5, meeting care home standards, we must give residents the highest standards of care and amenities in their chosen place of residence. Now, I would recognise, along with others, along with the staff and residents, that Trem Glyn might not be meeting all of those standards. I'm thinking in particular of the ensuite bathrooms. But we must also recognise that with the renovations that have been completed there, the residents are given the best of care and are extremely happy there. The staff are also very happy in their workplace. Just like to know, how much did these renovations cost and who paid for them? I'm not aware of that. The same page, para 333, states COVID has had a huge impact on care homes. We've already discussed this today and in previous meetings. And I think we've all seen the devastating reports in the media regarding the way in which care homes and their residents have been treated. People are now reluctant to go into care homes because of the mismanagement of the pandemic in care homes, not necessarily ours. But it is apparent from media that people are reluctant to go into care because of the risk of infection and the harsh visiting regime. We should really note that in normal times there is always a waiting list for Trem Glyn, and I think we've said this earlier on. There are only 3 spaces there at the moment. Local people know that this is a centre of excellence for elderly care, and residents are happy to spend the rest of their lives there. The home is well placed for relatives and friends to visit, and the new state-of-the-art medical centre is within close proximity. The GPs there will have known residents all their lives, probably. The staff are local and know families as well as the residents. And all of these facilities make the home a well-rounded facility. This is the Social Services, Wellbeing and Health Committee, so we do have a duty of care. We all know that, I'm not preaching to the converted, to staff and residents. And I just wondered if enough research has been carried out on the negative effects that these proposals will have on residents and staff. But to talk about, sorry, am I going on too long? No, just like to say about the health board, you know, they've been cutting cost beds over the years in cost-cutting exercises, only to realise, you know, what a huge mistake this has been when there are crises. Not only this pandemic now, but the flu epidemics. Every winter we have an epidemic in the NHS. So this pandemic is still ongoing. We mustn't. You know, what I feel is we know how tirelessly our staff have worked throughout the pandemic, but is this sort of proposal for a premature closure now a knee-jerk reaction to COVID? And are we here in the danger of making the same mistakes as the health boards by cutting beds? Dr. Councillor Del Morgan has commissioned research from Swansea University's Professor Verity. This research has shown that there will be an increase, not a decreased need for residential care. We know as people get older, the types of need will change, but the need will still be there. The research also looks at the dramatic impact centralising service as if placed far away from relatives and loved ones. I know the director is aware of this research, but I just wondered if officers had looked at this as well. I'm confident that admissions will go up again when the present risks, rules and regulations change. Those of us worked in the health and social services will have been told for many years that we have an ageing population. Carers are also getting older and might also have their own disabilities. With the present demographics, more beds will be needed rather than less. And I think, you know, the type of care and how it is to be presented is another discussion. And if we'd had the proposals, Pobber's proposals on what they intended for Glyn, we would have been better placed to make a decision today. Page 138 says people with complex needs are cared for at home with double-staffed domiciliary calls. Reports state that domiciliary care is cheaper to provide. Well, I'm at argue it might be cheaper, might be better, might not be better, but particularly if you can't get staff, as we've already discussed today, it's going to be non-existent rather than cheaper and better. Having worked in the valleys for many years, I know how difficult it is to get domiciliary staff. And, you know, we heard way in the past about half-hourly visits and so on. We don't want to go back to, we haven't had that situation, but we don't want that situation arising here either. I think also that people will want to stay in their own homes for longer, we know that. But if they have complex needs, there will come a time when clients, relatives and carers will not be manageable at home. Care will not be manageable at home. And, you know, I think we've seen this throughout the pandemic when visits and so on have had to be curtailed because of not enough carers and the risk of infection and so on. I would like to say something about Swansea Bay University Health Board. I mean, that's suffering from significant pressure in relation to the timely discharge of medically optimised patients. This will be exacerbated even more if fewer beds are available on discharge to move patients out to. The mental health services in Swansea Bay are struggling and are being remodelled. Much of the care will be delivered in Kevin Coyd Hospital, which is a nightmare for people to get to, even if they live in Swansea. It's going to be even worse for the Upper Valley areas. And I just wondered at the impact of these services being centralised, being considered by officers. We talked today about the pressure on domiciliary providers. So I think that's been said. We say on page 141, the council will work with Talbot to transfer residents into new care homes and would look to redeploy or find alternative employment for staff. And realise that we are looking after public money and we must get the best value for that money. But here, this seems, the report I felt was a little bit harsh. Didn't seem to be any empathy for staff and residents who might just be shipped out to other homes far away from where they've lived all their lives, and perhaps I'm being a bit critical there. Staff have to realise too how difficult it is for people living in the Upper Neath and Dilys valleys. Transport is practically non-existent, particularly on weekends and bank holidays. residents will be elderly, the carers will also be elderly. At the moment, people can pop into Trem, they can walk there, they can go there on a daily basis, whereas if they shift down to Talbot or to Neath, that's going to be far more difficult. And the other question I wanted to ask is that on page 143, NPT says that they will fund specific time limit travel costs, but the traffic survey that was intended originally was not completed. So if this survey going to be completed, and how will you decide on the amount of financial help and the length of time this will be? The closure of Trem will be a huge economical loss to the local community. Staff working in the area will spend money in the area. If Trem closes, the money will be lost to the community. Some of the staff would prefer not to be redeployed and will become unemployed, a loss of earnings for them and a loss of expertise to care services. Staff will not want to spend time on public transport. There's also if people are using cars, extra cars, there's a carbon cost to the environment, which goes against our strategy for that. All through the integrated assessment, so the report acknowledges there will be a negative impact on residents and families by closing the home. And also says that it will not be lessened or increased by the closure, but it will only delay the impact. And how can you measure this negative impact? Because the closure of the day centre was absolutely traumatic. The staff and residents were devastated when that closed. They'd been there for many years and it was providing a huge service to the communities. So, you know, the loss of Trem will be equally as devastating to them. I think we need more information from Pobl regarding the financial status. I think you've already said why it will cost more for us to pay Pobl to do what they were contracted to do. The report states that the decision to close was made in 2016, but I'm extremely unhappy with these proposals today. I did ask in a previous meeting whether the proposal by Pobl would be in place or a new build would be in place before Trem was closed, and we haven't had any reports back on that. And I think we all know that if patients or residents are shipped out from Trem, they're never ever going to come back. We'll know that for a fact. That's a great loss to the community. And I'd also like to point out the members have done an awful lot of work on the Valley strategy. Don't see any mention of that here, and if I'm wrong about that, I'd be glad to hear it. But it seems as if that all the work the members done, it's been paid lip service to, so that's very disappointing. And I just wondered if are we being held hostage by Pobl at this time, and should we be thinking about taking the service back in house? Thank you for your indulgence, Chair.
Right.
Sorry I took so long.
No, that's fine. I mean, I did say to Councillor Edwards that this is obviously something very, very close to her heart and to the other ward members, and I think she needed a chance to say everything. I did try to keep notes as she was speaking, right? And there are at least 10 different things that she has raised. And I've got them all written down so we can tick them off as they're addressed or not addressed. But officers, does anybody want to address any of what Councillor Edwards has just said?
Chair, can I start?
Of course you can. Take it away, Andrew.
I was desperately trying to take notes, but I couldn't. I don't think I got all of the points down. So if I miss them, I'll ask others to come in, or I'll need to be reminded of them, Chair, if that's okay. First of all, let me clarify then. So this report is not about reviewing whether Trem should be closed or not. That decision has already been made, and this report isn't about whether we should review that or not. That decision has been made, and this report is in light of that decision being made. So what we're talking about is the timing for Trem to close. So that's what this report in particular is about. This report also doesn't talk about the benefits of residential versus the benefits of domiciliary care in terms of a wider strategy from the council as where we go forward. Now, we didn't get a chance to introduce this report, but if we had have introduced it, then I would say that my recommendation to this committee and my recommendation to Cabinet will be to go with option 3, which is a temporary situation where we are saying we extend Trem Glyn for a further year with an option to continue to extend up to 2025. Now, the reason we say that is set out in the report, but that is because the marketplace at the moment, residential marketplace, is different, completely different to when we last reported back to this scrutiny committee in terms of Trem Glyn. The COVID pandemic has had a marked impact on the uptake of residential care. It's had a marked impact on our staffing and our ability then to safely move residents from one home to another and make those assessments, etc., in a timely way. The fact that we don't know what the market is going to look like in 5, 6, 9 months time, and in coming years, because everything is too volatile. So at the moment, I think it's not the right decision to say let's close Trem Glyn in March 2022. But I also say that it's not the right decision to say that we will extend it to March 2025. We need an interim position so that we can actually then understand better what the market looks like. Sometime around, I would guess that we'd have a better idea about that in May to September next year, once we see the impact of Welsh Government funding and reduction of Welsh Government funding. So that's the option that I would suggest. If I go through some of the questions, so the decision hasn't changed. If you go with my recommendation, which is option 3, then what that does is that gives a year for us to see what the market looks like, and then we will review it. In terms of the exit strategy from Pobble, well, you won't have seen an exit strategy because they haven't done one on the basis that they knew that this report was coming through to committee. And if committee decide that they are going to close, that they want to ignore the recommendation that I'm making and close Trem Glyn in March 2022, then Pobble will do an exit strategy and they will implement that. I've told them to hold off on that at this stage on the basis that I was to bring in this report here. And I was hoping that you would support an extension for Trem Glyn. The fact is that Trem Glyn is no longer a centre of excellence. The care might be excellent, absolutely. The geography might be good for those people who live in that area, absolutely. But it is not a centre of excellence because it is not built to a standard anymore that meets the care standards for Wales, and the option then to continue just to run Trem Glyn as it is not an option going forward. What we're not going to get into, because the paper doesn't cover any of the detail of this, is whether there should be more residential care homes built in Neath Talbot in the future. And I can't get into that at the moment because of all the reasons I've talked about around the volatility of care and the volatility of the residential care market. So I can't get into that at the moment, which is why I'm saying actually we need to defer a decision and make sure that Trem Glyn doesn't close next March and that we're able to review that as we go forward. The fact is that we did decide in 2016 that Trem Glyn would close and that we wouldn't build a new home in the Glyn area. The notion that what Pobble are looking to build in the Glyn area is a replacement for Trem Glyn, I have to say that's not right. It might provide for the needs of some residents or some people who might otherwise go into residential care, because it's a part of the development would be a supported living. But it would be wrong for me to describe that as an alternative to a residential care home. It is not that. We're much more talking about supported living environment. and we haven't had detailed negotiations with Pobl about what that might look like. So what Pobl have said to us is, look, they are looking to develop something in that area. Are we interested in being involved in that from a social care point of view for meeting the needs of older people? And absolutely, we've said yes, we are. Angela and I have been to have a look at some of the developments that they've set up in other parts of Wales, and we're really interested in that. But we haven't negotiated terms or anything like that, so we're nowhere near a point where we can come back to you and say, look, this is exactly what it will look like. But it would be wrong, as I say, for me to say that would be, or for us to paint the picture that this is an alternative to Trem and Glyn. I take exception to the comment from the councillor about lack of empathy for the residents and the staff at Trem and Glyn. As you say, councillor, the staff who and the managers who made that decision are no longer working for the most part, and we have continually come back to this scrutiny committee and to cabinet to find ways of making sure that when Trem and Glyn does finally close, that actually residents and these staff are at the forefront of our thoughts, and actually that is why today we're saying actually we shouldn't close in 22. We should actually wait and extend until we know more, and we've got the social work. You know, if we are going to close in March 2023, that we've got the social work support to ensure that they can move smoothly. So it's absolutely not the case that we haven't thought about the residents or the staff. The issue about time-limited travel costs and the whole notion about travel costs, I think that comes in any exit plan that we put together, and we will need to look at that. Councillor Edwards, absolutely, I agree. But we haven't got into the detail of that at this stage because our wish is that Trem and Glyn doesn't close in March 2022. Just having a look at my questions. So a number of the questions, I think, Chair, were about keeping Trem and Glyn open. I don't think that's possible, or building something in the Neath area. Well, I can't comment on that at the moment, and I'm not prepared to comment on that at the moment because of the volatility of the market. It may well be that we take a decision on that and we're able to take a decision on that in future years, but at the moment, now is not the time for us to make a decision. I'll give you an example of why. At the moment, we have over 150 empty beds, empty residential care beds across the county borough. A significant number of empty care beds. We have care homes that have occupancy levels less than 70%, which means if that carries on, that they will not be viable into the future. So we have significant doubt about what the market will look like in the future, and so we need to wait and let that play out with the support of the council to those residential care homes before we can make a decision about what the residential care needs are for the county borough into the future, and what the specific closure date should be for Trem and Glyn. So I probably haven't covered them all there, Chair, but if you can point me to ones that I need to cover.
Right, that'll do for a start. I just need to see how we're going to handle this. I know that Councillor Del Morgan is indicating, and Councillor Paterson, but the original plan was to hear what Councillor Edwards said, and then for Councillor Arwyn Wilcock and for Wyndham Griffiths to make their points, which might be much less than they were originally going to say if they find that some of what they were going to say has already been covered by Councillor Edwards. So I want to try as much as I can to keep to that plan. Councillor Morgan, thank you for your patience, and Councillor Paterson. But I think that a lot of the questions and a lot of the points raised are going to be very similar by different people. And somehow we just need to keep track of any point that has been raised by a councillor or any question that has been asked that hasn't been answered. So I beg the officers patience on this as we just work our way through this to make sure that every single point that has been raised is dealt with. So if we take Councillor Arwyn Woolcock, is there anything you would like to add to what Councillor Edwards had said, or any additional questions you would like to ask? And Andrew, have you got your pen poised? Yes?
Chair, I think that Andrew has answered most of them. It's just that my concern is about the availability of beds capacity in the care sector in Neath, Port Talbot. I think Andrew has just mentioned the number of vacancies that there currently are in the system. However, there's a lot of unknowns, and I know that Andrew has mentioned that as well. But initially, in the contract that we entered into with Pobble Group, there were supposed to be 4 care homes constructed, 4 new care homes constructed. That was subsequently reduced to 2. And many of the beds within initially the 4 and then the 2 new care homes were for respite care. Now, the more demand that we put on domiciliary care, the more demand that there will be on respite care. So I am concerned in us going forward. And the other point then, of course, is the volatility and the uncertainty of care homes in the private sector. Bearing in mind that care is a statutory requirement on the authority, I'm just wondering how long-term that is going to pan out. So those are my questions, Chair, not to go to run over the issues that Mr. Jarrett has already responded to. Thank you, Chair.
Right. Okay. Andrew, do you want to come back on any of that before I go to Councillor Griffiths? And can I just say to Councillor Noyle that I have noted your request to speak. Okay, Andrew, can I just say, Andrew, I'm getting a bit confused here because I'm trying to juggle. Let me just get my participants back up again. Yeah, okay. Relevant to what Councillor Woolcock has just said, about trying to balance the vacancies versus the demand. I did notice that in July 21, Trem Glyn had 3 surplus beds compared with 18 in other Pobble homes. So as a non-expert on this area, and obviously the local councillors know the area much better, it does look to me as though the demand for people wishing to go into Trem Glyn is still high, whereas there are vacancies in other care homes throughout the authority. So as well as answering Councillor Woolcock's questions, is this great number of voids being replicated in Trem Glyn, or is that in other care homes throughout the area?
Yeah, that will be other care homes throughout the area. I think Trem Glyn has 3 or 4 vacancies at the moment. I'm not sure, other officers will be able to help me with that. I suppose what I was describing by saying the number of vacancies across the piece is that I think the marketplace will change dramatically over the next, I'm talking about 6 to 8 months. So that's the impact. So what I'm not saying today, and what officers aren't saying, is that Trem Glyn isn't a very caring and well-run care home, that it's not valued by local residents. We're not saying that at all. We're saying that actually this council made a decision to close Trem Glyn in 2016. That's never changed. And the council made a decision not to build in the Glyn area. So they made a decision not to contract with Pobble to build those additional two homes that they were otherwise going to. Now, this report is not to do with that at all. We're not going back on that at this stage. And as I say, my advice to this committee and the cabinet would be the wrong time for us to start to think about whether we need to build more care homes or whether there are other options for us as we go forward. And that's why I was quoting the number of vacancies that we've got currently across the piece, because it's so different to what we've been used to. And what I don't want us to end up with is lots of care homes going out of business and lots of people having to move because we haven't got the market right. But I also don't want people who need to go into residential care, not being able to do that. So this is something which we need to look at over the next 6 to 9 months. Pull the strategy together. Of course, I would say, Chair, and this is very important, that the two options aren't, there's not just two options in this. It's not just domiciliary care or residential care. There's a whole spectrum of care that people will need as they get older and more fragile. And some of that is supported living. I don't think we don't do enough of that across Neath Port Talbot. Extra care, we don't do enough of that across Neath Port Talbot. So there's other options that we need to explore, and we need an overall strategy for that. This report doesn't address any of that. This report is talking about, given the fact that that the council have decided to close Trem Glyn, what is the time frame for that? What's a reasonable time frame for that? And should we extend it to 2025 on the basis of what we know at the moment about the current situation in the marketplace? I'm saying no, we shouldn't. Should we make the decision to close Trem Glyn as was previously agreed in 2022, so that's next March? I'm saying no, let's not do that either. We don't know enough about this marketplace to make that decision at the moment. What we need to do is option 3, which is extend for a year with a view then to making a final decision.
Thank you. Councillor Woolcock, are you happy for me to go on to Councillor Griffiths?
Yes, of course, Chair.
Thank you. Right, and again, I appreciate the patience of others who are indicating. Councillor Griffiths, is there anything that hasn't been said that you would like to raise, or any questions that you would like to ask?
I don't think so, Chair. I think Andrew was brought into the meeting into context, really, where he's addressed the question that I was going to ask about the new bill that was supposed to be happening with Talbot in Glyn, and so therefore he's answered that. So I'll leave it at that. Thank you, Chair.
Thank you. This is what we thought might happen in pre-briefing, that once the meeting progressed, various things would either be repeated or answered before we'd ask them. So, going through the people who have indicated in order, Councillor Del Morgan, welcome on board.
Diolch yn fawr iawn, Cadeirydd. Thank you. Well, here we are again. My colleagues and I in the Neath Valley have had to mount campaign after campaign to save our Trem Glyn care home over the past decade or so, and this really shouldn't have to be. We're talking about a care home here that over half a century has gained the respect and love of the whole community. We're talking about a home that has opened its doors to hundreds and hundreds of elderly people and their families at the time in their lives when they most needed the security of life care and peace of mind. Peace of mind that they can remain in their own familiar environment, in their kind of community. This care home has a fantastic and dedicated team of staff. They have worked hard to avoid any cases of COVID-19 amongst residents during the pandemic, and they have always walked the extra mile for these residents and their families. I can vouch for that. Even reading this ominous report, it is clear that there are seriously good reasons for not condemning Trem Glyn to closure. There's something of a revolution at hand in the care economy, with a staffing crisis in particular in relation to home care. Yes, people want to remain as long as possible in their own homes, but if insufficient care is available, then they have the safety net of a local care home to go to. And then there is the bed blocking crisis in the NHS. This is set to get worse. Also, if I can refer, colleagues and members and officers will have heard me say this many, many times. We are facing a demographic shift in the not too distant future, where the massive rise in population following the baby boomer years will begin to kick in, where these people will spill into their old and vulnerable age brackets. Many of these people without any near family or relatives to look after them. So the statistics we are contemplating right now will change very soon to a set of statistics that will be much worse in terms of care needs within the community. In the medium to long term, this home will still be needed. It should be subjected to changes that would meet modern government standards. In the meantime, please don't throw away the opportunity to give us time to consider all of these things and to look for plans that will work for the future. It is unfair to expect Valley residents to move to centralised homes in the large towns at that stage in their lives. Any overcapacity in the large new homes down there must be looked at in some other way. The Valley strategy for this authority shouldn't be remember to look after the Valley communities if at all possible. It should be to reprioritise and refocus our energy and resources into the valleys first and foremost, to make up for past years of underactivity and disappointment. I understand the financial pressures, but I appeal to the Council today to defer any closure of our Valley Care Home for as long as possible, both to cater for the short-term outcomes of the pandemic and to address the looming demographic time bomb that's ahead of us. Please go for the option that gives us the most time. Diolch yn fawr iawn, Cadeirydd.
Thank you very much for that, Councillor Morgan. Councillor Noyle, as another local member, I know you're on hold, so to speak, but I did have Councillor Patterson indicating first. So is it a question or an observation, or both?
I'm quite happy to defer to Councillor Noyle first, Chair.
Thank you very much for that, because I think it'd be good to hear for the three ward members who are most directly affected, even though, as I say, Carolyn Edwards is the neighbouring ward. Right, Councillor Noyle, welcome on board. I can't see you, but I'm sure you're there somewhere.
Oh, apologies, I haven't done my hair today, so.
Right, okay. Okay.
No, thank you very much for bringing me in, and thank you, Suzanne. Yeah, huge thanks to Carolyn and to Del for what they've said. And I echo everything that they've both said. I've tried to cross off things that they've both said so I don't duplicate. I will go along with saying that Trem is a fantastic place with fantastic staff and a local valley with the local valley communities, residents there who appreciate Trem, what it provides for them, the excellent community engagement that it has with schools, school visits there regularly, choir visits, and St. David's Day concerts and the like. I note that the decision to close Trem was done pre my time as a councillor back in 2016. And knowing that, I think it's fair to say that Del and myself had discussions with the director, the head of adult care and the cabinet member regarding the closure and whether it could be saved. We had those meetings from 2017 when I came on board to early 2020 when COVID took over, I guess. Question to Andrew, maybe a question or maybe a statement that he could agree with. During those meetings, I think it was fair to say that you were concerned with the decision that was taken by the previous director, and you were happy because we were looking at a different way of providing care. At that time and at those meetings pre-COVID, I'll caveat with that, pre-COVID, we were hopeful that a different decision would be made and we could overturn the decision to close Trem. I will not be happy to make any decision today, although it is worth noting and making it aware to members of the committee here today that the director and head of adult care had a meeting with Del and I last week where we talked about the report that was going to be coming in front of us. And whilst we understand the difficulties and the pressures of Neath for Talbot, I'm sure Del and I and Carolyn as well, I cannot be happy to make any decision of the recommendations today because we would deeply like Trem to remain open to be refurbished, as Del has said, up to the Welsh Government social care standards, and even grow from there. Yes, Andrew talked about different ways of providing care, extra care facilities and the like that people are looking into, but that won't help the staff, I don't think. I think the fantastic staff that work in Trem, although they could be two-beat over and work in different care homes, I think they're so enriched into Trem that it would be difficult for them to go and work elsewhere. And whilst we talk about going to work elsewhere, page 246 of the report identifies all the other care home providers within Neath and Talbot. It is worth noting in there, I think Del touched on it, that it is worth noting in there that there are no other Valley, or Neath and Delight Valley community care homes within Neath and Talbot. Yes, there will be on Abercrave and Colburn, but they're not Neath and Talbot as it's identified on page 246. So again, along with Del, I suppose my plea to the members of the committee today would be to give Trem and Glyn the most amount of time that it possibly can to understand whether what care providing is going to look like in the future. If that's until 2022 and this time next year where we understand that a bit better, or it's deferred even longer than that again, then that's what I would be looking for. Or even if you don't think there's enough information contained within the report, that you don't agree to any of the options, and then perhaps Andrew and his team can look at something a bit different. But again, thank you very much for allowing me to speak, and I look forward to hearing what comes next. Thanks.
Thank you, Councillor Noyle. Suzanne, you've been incredibly patient. And Andrew, I can see you want to come back. Before you come back, Andrew, and before I move to Suzanne, we've had at least 3, possibly 4 councillors, some members of the committee, some members who are visitors to the committee, and we've talking about the actual whole concept of the decision to close. So before I go to Andrew and Suzanne, bearing in mind we've got the legal guys here, am I assuming that there is no way that the whole decision to close the home can be reversed? John.
It can't be reversed by the Cabinet Board today because that decision has been taken. It's not a matter which has been put onto the agenda and publicised as something which is to be considered. It doesn't prevent decisions today don't prevent steps being taken in other ways by members to seek to reverse that decision, but it's not an option open to the Cabinet Board today to take.
Thank you very much for that clarification, because this is a subject we've skirted around for most of this meeting. We're all talking about the 3 options that are available, and there's obviously a very strong will from some people not to close the home at all. But as John has just said, we are where we are. So that's just worth bearing in mind. Suzanne, do you mind awfully being patient just for 1 more minute whilst we let Andrew come back? And then, Suzanne, the floor is yours, the virtual floor. The screen is yours. Andrew.
Yeah, thanks, Chair. Just in response to Councillor Morgan and Councillor Noyle, there's no hiding the fact, and I hope this scrutiny committee will back me up, that I have been a real supporter of Trem and Glyn, and I along with the local members, have put forward the option of, well, actually, could we keep Trem and Glyn open for a bit longer? And I've always said that, and wherever I've been asked, and I think Councillor Morgan would back me up and say I've worked really hard with Pobble to try and negotiate that. So that's the first thing. But we do have to be realistic. And I've never said that Trem and Glyn in its current form can remain open long term. That was never my intention. I've never said that. The bit about deferring a decision, I would say that would not be a really good idea at the moment, Chair, for Cabinet to defer a decision. I think there is something about the staff and residents of Trem and Glyn having more certainty than they do at the moment, or at least they've got certainty at the moment, which is that if we don't make a decision today, then Pobble will continue with preparing to close Trem and Glyn in March 2022. Okay, so they will then provide the exit strategy, and they will do that. That's already the train that we're in. So that if we do nothing at the moment, that is what's going to happen. Mm-hmm. Now, Pobble have agreed, and they've got back to me yesterday to say yes, they're willing to receive a recommendation that Trem and Glyn continues for a further year. So that's up to March 2023, pending all of the reasons that we've discussed today. They are not interested in running Glyn as it is in the long term. We couldn't bring Glyn as it is into the council and continue to run it in the way it is. CIW, the Care Inspectorate of Wales, will not allow that to happen because of the fact that it doesn't have the facilities that are expected in modern day residential care homes. So that does leave then the future is that Glyn, as it stands at the moment, will need to close at some point. Right. What replaces Glyn is something which we still need to discuss, and when that point is, we still need to discuss. Which is why I'm saying, I would recommend to Cabinet that actually we take option 3, which gives us that year to look at what the marketplace looks like into the future. So that's where we are. I would say it's would be a bad recommendation if what we were saying was don't make a decision today and let's kick it down the road for a bit, because that just means that residents will have to be told that Glyn is closing in March next year, and to prepare for that. And I don't want that uncertainty for them, because I don't think it's the right decision at the moment. And of course, Councillor Morgan talked about just making a decision to continue till March 2025. Well, there's significant costs to that for the council. We're already going into a budget which is a deficit budget. There's significant costs to that, and there will be significant impacts potential significant impacts for residents if we don't make decisions sooner rather than later, in terms of the choices that they might have around which care homes they might go to otherwise. So as I say, I keep coming back to my recommendation, which is, look, it's not the right time for us to make a long-term decision about this.
Thank you for that, Andrew. Just keep giving us the same message. We know where you're coming from. Right, okay, I can see the Cabinet member, but Suzanne's been patient for so long. Suzanne.
Oh, thank you very much, Chair. And I was more than happy to let local members speak, because, it is in the forefront of their minds, and it's in the forefront of ours, but we are a bit more removed from it. We're not getting the emails and the letters and the phone calls. So I do understand that. I think historically, we know that the decision was made. However, the director, Angela's post, even the Cabinet members' posts are all changed since then. So we do have a different set of staff, a different set of people who are giving their advice on this. And since Andrew's appointment, I can't argue with anything he's suggested to committee. His advice has been spot on so many occasions. We didn't know about COVID. We still don't know about COVID, what's going to happen about that. There are so many things in the report, that, like the transport in report, that should have come out that hasn't been able to be done. So I am more than happy with the recommendation from the director that we go with option 3, with an option that might not be the end date, because the director has said, look, we look at it again in a year's time. It's a bit like when you get off a seesaw, you'll bounce up and down, and you need time for it to level off. And I think that's where we are with the COVID situation, with the situation in the marketplace. In a year's time, we will know how many care homes have actually made it through. We will have a much better, guide as to the care sector in general within Neath Port Talbot. So personally, I've never, as I say, I'm going to take the director's advice on this, and I will be voting for option 3, because I think it covers the best of all options. It doesn't say to residents, you're going to close, you've got to get out by next year. It gives them a certain amount of security for 12 months at least, maybe more. If we still don't know at the end of the 12 months, it may be extended, may not be. But I think that the residents, the families, the local members will probably have the best option if we go with option 3. So thanks very much.
Thank you, and thank you for your patience, Councillor Patterson. I can see you indicating, Councillor Griffiths, but the Cabinet member did indicate a few minutes ago. Did you want to contribute to the debate?
Thank you, Chair. I've held back, obviously, to listen to what everybody's had to say.
We haven't finished yet. There's still more questions. Do you want to wait until we've finished?
Yeah, I'll wait for you to finish.
Okay, yeah, thanks for that, because I've got several more questions, factual questions. Thank you for your patience on that. Councillor Griffiths. Wyndham.
Thank you, Chair. On reflection of what's all been said in this meeting and all that's gone on, you just brought in John to ask about a legal thing to go forward. Is there any place that we could recommend that, as Trem Glyn is destined by the look of it to close, whether in 25 the decision was made in 2016, whether we as a committee can ask that the decision not to build the extra care homes in the extra 2 care homes could be reversed. I was just wondering that, because what I don't like about this thing with Pobble is it's very vague of what's coming forward. But is there anything in the Constitution that we could do that? Thank you, Chair.
Thank you for that, Councillor Griffiths. So, John, just in case you missed that, we've asked you the question whether the 2016 decision could be reversed or revised, and you've advised us that that's not on the agenda, so there's no way that conversation could have to be discussed today. But Councillor Griffiths is asking about the decision that was taken some time ago not to build the 4 care homes, but only to build the 2, whether that decision could at some future point be looked into. Is that doable? And I'll come back to the director in a moment. From a legal point of view, because we're just not experts on this.
Well, Chair, given that and I wasn't involved in the taking of the decision or advising upon it, given that was something which was agreed with Pobble at the time as a variation to the agreement, it would similarly require the agreement of Pobble to a further variation in terms of what they were going to be doing in the future. There is no problem at all in this committee in making recommendations to the Cabinet Board, raising a number of matters which it would like Cabinet Board to take forward, which could be, for example, whether there should be a reconsideration of the original decision to close, and also whether there should be some further discussion and negotiation with Pobble concerning future intentions. So it can certainly be raised in that respect.
Thank you very much for that. Right, future plans. I'm just making notes to myself. Right, Andrew, you were indicating, and Cabinet member, that there is a little bit further to go. So if I just put you on hold until we've finished drilling down into all of this. Andrew, did you want to come back on any of that?
Yes, thanks, Chair. Only that I don't think it would be right to jump to the position that actually what we want to do is reverse the decision that was made before without this committee having all of the information it needs around the strategy that we're going to be taking into the future. Because otherwise it's an arbitrary decision and you haven't got enough information, I don't think, as a committee to make those decisions at the moment. I haven't got that information and enough information at the moment to make that decision. So I think that it would be, if you wanted to as a committee, you could certainly recommend that we look at our overall strategy and that you would want that back via a certain particular date. And if that strategy said, actually, what we do need is a lot more residential care homes and we need to build them, then absolutely the committee would support that. I recognise that. It might say something very different. Actually, that's not what we need. And I suppose what I'm saying is, we need to give us a number of months in order to pull that strategy together before you make that final decision or that recommendation. So the recommendation, I think, is about the strategy that you want to see And what I'm saying is it's such a difficult time at the moment that actually it's going to take us 6 to 9 months to pull a strategy together.
Yeah, thank you for that, Andrew. I wasn't honestly proposing doing anything radical or drastic today. I just that particularly as we've got people here in the committee who are not committee members, to know that we are looking at the whole issue and looking at what is possible, possibly at some future date. Not making no recommendations today, but instead of just accepting the care home has to close because we decided it in 2016 and no new care homes are going to be built because it was decided at X date, to say that these things are possibly debatable at some future date, but no way would we be going to make recommendations without being aware of all the facts, having those in front of us. And I agree with what Suzanne has said, that the advice you've given us over the years since you've been appointed, we've had no problem with any of it. It's been very, very well thought out and well researched, and we do appreciate that very much, particularly in such a difficult situation as this. Right, I've got loads of people indicating now. I'm putting the cabinet member on hold. Councillor Del Morgan, you wanted to come back.
Thank you, Chair. Just to start by confirming the Director, Andrew Jarrett's certainly been very supportive of Trem Glyn. I will certainly concur with that. A total breath of fresh air, if I may say, looking back to previous directorate. But I wanted to add that we've got a report, a very comprehensive report in front of us today with these 3 options and then a splintering of finance options beyond that. And I was surprised actually that none of those 3 options were recommended actually in the report in writing. We've subsequently heard today the Director mentioning option 3. I think I'll just restate something which everyone seems to agree upon, and the Director in particular is making this point, that life has changed dramatically over the past 2 years, and we really don't know how the future is going to unfold. And I'm probably talking about the short term as well as the longer term future in relation to the pandemic. Are there more variants in relation to the NHS, in relation to Brexit, in terms of staffing? What staffing is going to be available in the care sector? It is really up there. There's no crystal ball. We don't know. Now I'm wondering whether we are going to know much more in the next 6 months. I don't think so. But the point is agreed that we don't know, and that's a worry. But it's also, I think, a pointer to how we should be planning and strategizing here. I'll just say this then about the 3 options before us. The option to enter into a 3-year contract, it doesn't say any more than that, whereas option 3, which is what the Director is I think making the case for now, goes on to say that we will review and we will discuss with Pobble and all the rest of it. Well, I'm hoping that there might be a 4th option, which is basically to go for a longer and a more sensible period of reflection and trying to learn where we are in terms of the future. So looking at the 3-year period, but including the reviewing options that he mentioned, in option 3. So that would be my plea, to consider the longest possible period of time for reflection, including all the reviewing that you can do. And of course, the questions raised just now about alternative decisions from 2016, those other options or other considerations can be carrying on in parallel. But I would ask members today, I don't even have a vote in scrutiny, let alone the Cabinet Board, but please give us as much time as we need, because the future is unclear. Give us the flexibility. I understand there's extra resources involved and complications, but the people in these valleys, Neath and Delice valleys and beyond, they deserve it. Please do that. Thank you.
Thank you. Okay, Suzanne, I can see you indicating.
Thank you.
Did you want to come back to what Della just said, or can I go to Suzanne?
Sorry, Chair. Was that me? Sorry, my connection went.
Yeah.
No, I'm
You're okay there. Suzanne.
Thank you, Chair. Yes, I do agree to a certain extent with Councillor Morgan. We need to give Trem Glyn as much time as possible before the closure. It's already been decided that it is closed unless something happens in the future. And I would like to not tie the director's hands to the 3 years, to give him as much option with what's going to happen in the future. I think option 3, although it's only a year, we will be able to give the director the wriggle room then, rather than tie him into a 3-year contract with Pobble, and maybe at the end of the first year we might realise that is not what is required. So he's already said there's an option at the end of the first year to extend again. He's open to that option. He's spoken with local members quite glowingly about Trem Glyn, so we know that it's not our choice. Basically, we have to comply with the rules from Welsh Government that say that going forward, these care homes have to have ensuite facilities, they have to have extra things, and that's all good for our residents to comply with those rules. But in the meantime, let's just go with the option 3 to give him the most wriggle room that he can have. He can come back, and if he's not ready at that point to say, yeah, this has to close, then it can be a little further down the line. I don't think that the residents of the care home would probably think that that's the best option. They would like clarity, of course, but I think as a committee today, that's probably the best option that we can give them. Thank you, Chair.
Thank you. Before I bring Arwin in, who is indicating, there was, because when Councillor Richards, the cabinet member, said he wanted to come in, I said, we do still have a few questions. There's one question I just wanted to specifically ask myself. It could be similar to what Arwin is wanting to ask, which is on page 140, it talks about the timely discharge of medically optimised patients, which will need care homes as a pathway. And I just wondered, in all your discussions with Pobble, Andrew, have you had any discussions with the Health Board, and what is their opinion as to whether Trem Glyn is needed in the short term or in the long term?
Short answer to that, Chair, can I come back in?
Yeah.
Sorry. The short answer to that is no, not specifically around Trem Glyn, but around the care home situation. We have weekly conversations with them around the totality of the care home situation, and I suppose that's the important bit. And Councillor Morgan's absolutely right. So we might not have full clarity over the next 6 to 9 months, and I might be in a difficult position then, and I'll have to come back to you. But we can't keep deferring a strategy because things are up in the air. We have to move to a strategy for caring for the elderly across Neath Port Talbot, what that looks like in totality, and what the residential part of that will be in the future. We can't just keep deferring that. I'm clear about that. What I'm hoping is we will be clearer in 6 to 9 months, because as I said, there are some significant things that are happening in the residential care sector over that time.
Thank you. Right, we have been at this a long time, and at some point we are going to have to go into private, because I have 2 members who've indicated that they wanted to ask questions about matters that are in the appendices. That was Suzanne Paddison and Carolyn Edwards. So I'm going to take the people who have indicated at the moment, then I'm going to suggest we have a comfort break, because it is actually 4 o'clock, right? Or go into private and then have a comfort break, or vice versa, right? Then do the private bit, which is the questions on the appendices, then go back into public to actually come to the decision about what we want to recommend to Cabinet. That seems to be a plan. So I've got indicating, so Cabinet member, can I leave you on hold until after we've done all of that? I've got Del, I've got Arwin, I've got John. I think I better take the legal guy first in case we're about to do something wrong. Right. John, can we have your input next?
Yes, Chair. I'll be very brief and just to simply say that you'll appreciate as a committee, you must apply your mind, as Andrew reminded you, that this is looking at the evidence and a decision of when it is appropriate for the home to close. It would not be appropriate for you to base your recommendation upon seeking to achieve another outcome, i.e. that the home remained open. And therefore, I think if you were to depart from the firm reasoned recommendation from Andrew, then you should be very clear as to why you're doing so and to do so on legitimate grounds. It doesn't prevent anyone from following in another way the reopening or the seeking to reopen decisions by the council, but you must be very clear that you are basing your recommendations today upon the facts put for you in the report and the evidence from officers.
Thank you very much for that guidance, John. In no particular order, but I better do it by the order on the list. I've got Councillor Del Morgan, unless that's a legacy hand, and I've got Councillor Arwin Woolcock. Del, would you like to speak again?
My hand isn't up, Chair, and it's not shown as up here either, so I don't know.
It's disappeared now. This is the beauty of technology.
There we are. Well, I've made my points, and thank you for your time,
I thought you probably had concluded what you wanted to say. Councillor Arwin, is that a legacy hand or is it a new one?
No, it's a new one, Chair, and I'll take it down straight away so that it doesn't confuse any of us. I hope it's gone. Yeah, I just wanted to try and move things on then a little bit, Chair, if I may. And perhaps Mr. Hodges could comment at the end of this. The way I see it, that as a decision to close Trem Glyn has already been taken, then option one is effectively the default position and not for consideration within this report. Sorry, anything else is not for consideration within this report. In other words, not to close Trem Glyn at all. So option one would be the default position as I see it. Option two, as I see it, is included within option three. So I would suggest, Chair, and I'm happy to move this if you like, that this scrutiny committee request Cabinet Board to approve option three when they meet following this meeting. And then subsequently, any future consideration for care homes can be considered at a later date when hopefully more information will be available. And I think that's the point I was trying to make in my remarks earlier. So that's the way I see it, Chair, is that option one is the default position. Option two is included within option three. Therefore, I would be happy to move option three going forward to Cabinet later on. Thank you, Chair.
Right. Even though we've been at this for hours, we're not quite at that point yet, because I have had two councillors requesting to go into private so they can ask questions about the appendices, and we must have those questions asked before we come to the decision. But I'll bear in mind what you've said, Arwin, for when we eventually get to that point. I've got our legal advisor, John Hodges, indicating. Can you help us, John, or is it a legacy hand? Technology seems to be going mad. Perhaps it's tired. Are you indicating, John?
No, it's technology, Chair. At my end, my hand is shown as lowered.
Right. Okay. Let me just confer with my notes and with my Democratic Services Officer ready to assist. In pre-briefing, we had two councillors who wished to ask questions about items that are in the private appendices. Can I check, first of all, Councillor Paddison and Councillor Edwards, do you wish to ask those questions? Still, not now, because we haven't gone to private yet, but are you wishing to ask those questions?
No, I made the comments, Chair, and I think some of them have been answered, so I'm happy for Councillor Paddison to go forward if she wishes.
You're happy. Councillor Paddison, do you want to go into private to look at the appendices?
Not now, Chair. I tell you why, because one of the options doesn't apply in my mind anymore. So no, I'm going to defer that now.
That makes it simpler. Having written out the private bit, we now know don't need to go into private. Okay, now we're getting somewhere. Right, my advice from Craig Griffiths when I looked at these recommendations, which basically there wasn't a recommendation, there were 3 options. My advice from Craig was to sum up, myself personally, then ask people to, if they were minded to do so, to propose option 1, we would take a little vote on it, propose option 2, take a little vote, propose option 3, and then make our recommendation to Cabinet. Before we do that, somehow I've got to try and sum this up, and I just don't know how I can, but I'm going to pick up on something Councillor Del Morgan said, which is basically, has anyone round here got a crystal ball? Because that is the problem. The decision made in 2016 didn't know anything about COVID-19. The decision that previous officers were recommending knew nothing about COVID-19. Even the research that Professor Verity has done in Swansea at the request of the ward members was presumably not taking on board COVID. So we are absolutely stuck in this situation where we have to best guess everything. And that is why we have these extremely qualified professional officers that we are minded to trust, because they have done a very good job for us, proven to do a very good job for us over previous years. So basically, we need the arguments for all 3. I don't need to go to private, so I can skip that one. No, hang on. I need that piece of paper. Sorry, it's been a long afternoon. Right, okay. Here, where am I? Oh yes, there's no specific option recommended in the report, although we have had recommendations coming from the officer. So we need to assess the opinion of the committee, bearing in mind that we confidently trust that the Cabinet members will take note of our debate and all the opinions expressed. Before we go to taking those votes, does the Cabinet member want to come in and say anything? Because he's disappeared off my screen. Do you want to say before we take the vote or after the vote, Peter?
Sorry?
Do you want to say anything before we take the vote?
What can I say? You know, it's been a 2-hour debate. You know, we're expecting, you know, it's a very important issue. Firstly, what I wanted to say was mentioned earlier about the Trem Glyn itself. You know, I know Trem Glyn. I have visited Trem Glyn. The service that's been provided there is second to none. I'm sure will always be that way. I know how committed the local members are to that provision. It is a fantastic provision. Where I am here, the difficulty I have, this decision was made, and we keep going back to this, in 2016. And, you know, we're not crystal ball gazers. It's a difficult situation. Moving on from that, I've had to take advice again of professional officers, working with them. We've spoken to the local, well, 2 of the local members to give everybody opportunity to be part of the debate before we come to a decision. So, as I said, it's difficult, but I certainly go along with what's been said. I think Arwin mentioned with regards to option 3, Andrew certainly encouraging option 3. I think we have to be there because of the uncertainties. The marketplace as it stands at this moment have already been discussed. We don't know where we are with that. So we'd be wrong to close that now. We need time to understand the way things are going to pan out over the next few months, and then we'll be in a better place to work with the director and with the team to come up with a more stable, more suitable understanding and decision. Thank you, Chair.
Thank you. Right, okay, crunch time, here we go. Is there anybody wishing to recommend support of option 1? Deafening silence. Is there anybody with a vote on the committee who is wishing to offer support for option 2? Anybody? Oh, Carolyn, yes?
Yes, I would prefer this option, Chair, but possibly with a view to reviewing the situation as in option 3. I don't feel that 1 year is long enough really for Pobl to come up with their plan and or our officers to have a strategy for residential care or further care. So I would be preferring that option. Thank you.
So basically, let me just check I understand exactly what you're saying. To say, enter into a new contract with Pobl to 2025, but to build into that 2025 commitment, let's say annual reviews, is it? Is that the sort of thing you're looking for? Right, okay.
Yes, I think that would be sensible, yeah.
Right. Before we go to the vote on option 3, is what Councillor Edwards has proposed doable? Andrew or John, or both? What she's basically saying is enter into a contract till 2025. So the commitment is there. I presume that's to give peace of mind to the people who work there and the people who are there as residents. But building into that, basically an annual review. I mean, if it's just not doable, it's not doable. But I just need to know before we go on to the last bit. Andrew.
It is doable, Chair. I just think it gives residents and staff false comfort, really, because if we're reviewing it every year and we could at any time say no, actually that's not the case, then it's not giving them that date. Right. So that's my view. I think it is doable. Yeah, absolutely.
So it's not achieving anything in that, although we're saying 2025. It could be reviewed at any point. And so what Councillor Edwards is trying to achieve there, which is this peace of mind, wouldn't be a peace of mind. Am I right? Because it could be reviewed at any point.
That would be my view. Either the committee should say it's going to be open till 2025, which I'm not recommending, or it's going to be open until 2023. I think those are the two options at the moment, Chair. I think that the other way, yeah, I'm not sure that does help with either the planning or for residents.
I just wanted to thoroughly explore that so that Councillor Edwards knows where we're coming from. Right, and finally,
I can see that point of view, but option 3 is saying it's going to be reviewed in March 23 anyway. So the uncertainty is there because in March 23, we could be saying, well, okay, that's it now anyway. That's the point I'm trying to make. Thank you.
But yeah, right. John or Suzanne or right? No.
Your Chair, can I say I don't believe that the Cabinet Board could adopt a recommendation to adopt a recommendation which is not part of the paperwork which has been put before them and publicised. So whereas you could make it as a recommendation, I would have difficulty in advising them that they could adopt it today, so that in addition to the points raised about the lack of additional certainty that it would give, because there wouldn't be any additional certainty, I think that there would necessarily be additional delay for a fresh, properly publicised proposal to go before Cabinet Board.
Thank you, John, for your balanced advice on that. Yeah, I can totally understand that now, that we have to make a decision based on what's in front of us. So you may not be terribly happy with that, Councillor Edwards, but that's how it is, I'm afraid. Councillor Paterson, did you? I
just wanted to add one bit to Councillor Edwards's suggestion, is that it may actually cost the council more money in the long run, if we did that option 2, because we haven't gone into the private part, so we haven't discussed it.
Let's not muddy the waters.
Okay.
Councillor Edwards has asked, can this be done? Legal guys have said, no, it can't be done because we have to vote on what's in front of us. We've debated it for a very, very long time. So now, finally, would somebody like to propose that we recommend to go to Cabinet that we support option 3? Can I have a proposer, please?
Yes, Chair, I'm happy to propose that.
Right, and can we make sure this is all noted, Chloe? Can we have a seconder for option 3?
Happy to second, Chair.
Right, that was Councillor John Miller. And can I have an indication, it better be hands up so we can make sure we've absolutely got this right, of everybody in support of that recommendation, please?
I support, Chair.
Can I ask that it's electronic hands so I can see?
That's what
not
I meant.
virtual.
Electronic hands, please.
Thank you.
Yeah.
Sorry, I'm on my phone now, so I can't find my electronic hand.
Councillor Davis, I'll mark you as a hand up anyway, because you've just confirmed that. So
you're a virtual electronic hand, right? Are you okay with that, Chloe? We'll just pause a second while she counts.
Councillor Pascal, I've got 10 hands, obviously with including Councillor Davis's hand, which I can't actually see. And I've noted there's 11 members that can vote in this committee. So obviously that just leaves Councillor Edwards, who voted for the previous option.
Did you get Arthur Davis, who's waving at us?
Yep, I think so. Yep.
Right.
Yep, I've got it. There's more hands up for the options, the third option.
I wonder whether we ever will end up in an actual room where we can actually see everybody again. Who knows? Right, okay, I'm just trying to lower my hand and I don't know how to do. Oh, come on. Right, sorry about this. Let me just try and lower my hand. Right, okay. Let me just go back to my papers, because this has been a very, very long session. So, future of Trem Glyn, we're not going into private because we decided we didn't need to. So therefore, I go back to this. We've got going to the Cabinet support for option 3. Am I right, Chloe? We've concluded that item. We don't do any more proposing or seconding.
There's just the other 2 bullet points that are listed under the recommendation will also, if members could just propose and second those just for clarity reasons, because they'll also go to Cabinet Board.
Yeah, very good point. So if we find the recommendation, which is on page 158, can I just have somebody to propose and to second the rest of what's in the recommendations? Can I have a proposer, please?
I move, Chair.
Thank you. And a seconder.
I'll second, Chair.
Thank you. I think we've finished that one. Have we finished that one now, Chloe?
Yes, we've concluded that one now, Chair.
Thank you. And breathe, everybody. Right. Okay. Now, this is important. You might think it's time to go home, but not quite. The forward work programme, and there were issues raised in pre-briefing that we decided, instead of going into private to debate today, we would like included in our forward work programme, and Councillor Patterson was going to raise that now. If you could raise that for us, please.
Yes, thank you, Chair. Yes, it's to do with the Disabled Facilities Grant and waivers. And I think the committee felt that we would like a better understanding of the whole process. So we would like that to be put on to a future meeting for us to look at.
Sorry, I forgot to tell you, committee, we are actually back on the scrutiny papers. We're looking at the scrutiny forward work programme, and Councillor Patterson has raised that, which is excellent. So Chloe, can we get that put on our forward work programme? Yeah?
Yes, Chair, I'll obviously liaise with Charlotte outside the meeting with that particular item and officers as well.
Brilliant. Now, I have no urgent items. Excellent. The issue that we wanted to go into private for to debate, which is agenda item 15, we've now decided that that's gone on to our forward work programme. We don't need to go into private, so we don't need to scrutinise, as far as I can tell, anything else today. But I'm just waiting for my Democratic Services Officer to confirm that that is the case.
Chair, was there a decision to be made on item 15?
Sorry?
Was there a decision to be made on item 15?
Yeah, we decided in pre-briefing that originally we wanted to go into private to discuss it, but then we decided that it would be better to put it into the forward work programme, so we weren't going to scrutinise it. But if you want to scrutinise it, we can go into now.
I'm a bit confused. There was a decision to be made on that one item 15, which I'm not sure whether Mr. Hodges can tell. We haven't deferred that decision. We've only put an explanation of them onto our forward work programme. So I think we still need to decide that one. I'm not sure.
Right, I'll just explain again to John where I think I'm coming from. Right.
Sorry, Chair, I confess that I'd taken advantage of a chance of a quick comfort break, so
Yes,
I missed most of what
I'll
Councillor Patterson
start at the
said.
beginning. We were almost at the end of the meeting because we decided we weren't going to scrutinise agenda item 15. We did have questions to do with it, but we decided to put those questions into the forward work programme. Now, what Councillor Patterson is asking is, do we need to scrutinise it because it involves a decision? My reading of the situation is we don't always scrutinise every single item on the Cabinet papers. Sometimes we decide, no, we'll let Cabinet decide that, but we want to drill down into it further in our forward work programme.
Yeah,
Councillor Patterson, oh my God, it's been a long afternoon. Councillor Patterson is asking, is that okay?
Well, Chair, you've given the answer yourself. You have a choice as to which Cabinet Board items you scrutinise. If you simply choose not to scrutinise this one, it will go to Cabinet Board. If they make a decision today, a decision has been taken, which may or may not limit the extent to which future examination can produce a result, but you have a completely free choice as to which items you do or do not scrutinise and upon which to make recommendations.
Yeah, I'm clear now, Chair. It's okay. Yeah.
Thank you for confusing the issue further. No, not you, John, Suzanne. I'll have a word with her afterwards. So, we have decided that although we have issues to do with what would have been debated in agenda item 15, we're not going to scrutinise it. We're going to scrutinise the whole issue of disabled facilities grants in more detail in our forward work programme. Right. Okay, so I go back to my piece of paper. I have no urgent items. We're not going into private. So thank you all for your attendance. I will now bring this meeting to a close. Thank you for your patience, everybody.